CLARE is a community-led initiative that enables people to maximise their independence by working together to develop creative solutions that will change their lives for the better. We work in partnership with Belfast Health and Social Care Trust and primary health care professionals to engage with individuals who would benefit from low-level supports that would improve their quality of life. We support people to identify the things that will improve their quality of life and connect them to appropriate and timely services and community resources. It all starts with a person-centred conversation that can lead to a journey of positive change.
CLARE has been an invaluable service which we have used from the hospital. I have referred patients coming out of hospital who have needed further support on discharge apart from core services. They've lost their confidence, they've started to become isolated, they've started to feel detached from their community. So by referring to CLARE, they've been able to take them home from hospital, get them settled back at home, help them sort out their financial affairs, get involved in the community again, get involved in interests they felt they'd lost the opportunity to get involved in. So I personally have found it very invaluable, and the feedback that I've got from the families and from the patients has been positive. They've felt that they haven't been able to do things before. They've got back into doing things that they've done before.
Belfast Central Mission's Housing Support for Older People helps people over 55 in the Greater Belfast area to remain living independently at home for as long as possible. Those issues that we can be presented with is hoarding issues, substandard living conditions, or simply they're just not able to manage the home due to maybe physical or mental decline over a period of time. We assess our service users as needing housing support, but we also look at a holistic view. So we're dealing with issues such as maybe finance, mental, physical health, or social networking. So we have worked with the CLARE Project in partnership for about 4 years, and the very fact that partnership working is proving now that we are offering as organisations a much better joined up approach in supporting our older people to live and remain independently in the communities.
CLARE offers a range of student support placements across social work and health and social care studies. Our students are a valuable resource and enable us to reach out to more people.
The CLARE Project has really benefited my learning here. I've been able to experience real life examples, and I've been able to put my theory from college into practice. I've really enjoyed my time here, and I think it'll really benefit me for my future career.
We facilitate meaningful and supportive volunteering opportunities. Our community champions provide friendship and support with practical tasks like getting to the shops, connecting to social opportunities, and support to attend medical appointments. Our volunteers are a valuable resource and have a huge positive impact on the lives of isolated people.
Well, Mum and I first heard about the CLARE Project through a social worker that was working in Meadowlands. After having spoken to Mum and myself at length, Pauline felt that the CLARE Project could have a real positive and beneficial influence and change in our lives. So she put through the referral, and it wasn't long after Mum's discharge that Mandy from CLARE got in contact. To be honest, whenever it comes to the CLARE Project, the impact that it's had for both Mum and myself is completely immeasurable. I cannot stress enough how much of a support mechanism CLARE has been. Mandy, who has been our direct point of contact, has been amazing throughout the entire situation. She comes in, she spoke at length to both Mum and myself to sort of assess where the gaps were, where we needed help and a little bit of advice and guidance in terms of joining the dots together in relation to the services that are potentially out there to help individuals in the community who are elderly and need help in relation to things like housing, transport, disability, all of that. She was able to put us in contact with individuals from BCM, even down to the ambulance service, fire crew coming out to do a fire assessment on the house, things that we would never have thought that we would have been able to get. Claire were really able to put us in contact with those individuals, and it's made such a significant difference from that side of things. But if I'm completely truthful, I think the largest impact has been on wee Mum herself. One thing that she suffered from quite a lot was social isolation. And I think whenever it comes to medical professionals and social workers in general, they don't realise the psychological impact that ill health has on an individual. And once you kind of get into that downward spiral, it can be incredibly difficult to get out of it. But with Claire, they understand that, they see that, and through their befriending scheme, they try to directly address that issue. In the case of Mum, she was paired with a fabulous girl called Rachel, who comes in once a week and does crafting projects with Mum. The thing about those crafting projects is that not only has it helped Mum build a great relationship with Rachel, where she looks forward to her coming every week, but she also has those goals of completing different projects and that sense of achievement of, look what I have been able to do, look what I've done. And it's one of those things that Mum actively looks forward to every week, and I honestly cannot express the difference that that's made with her on a psychological level. She is an entirely different person from what she was last year, and I honestly do put that down specifically to the CLARE Project and to Rachel coming in. They've been an amazing support to both Mum and myself, and it's a fantastic scheme, fantastic initiative, which I think everybody should be able to avail of that are in the situation that Mum and I have been in.